This is a webinar that will discuss what is working well in the industrial trans fat elimination strategy, particularly looking at the behavior in different regions. But we also would like to understand what are the issues on elimination of trans fat when the regulations are not in place, and what is the behavior of commercial entities in the food supply chain. We have a very exciting webinar today with an extremely prestigious panel. Let me introduce them at the beginning. Rita Teaotia, the chairperson of the Food Safety and Standards Authority of India. Good evening, Rita. Dr. Tom Frieden, the president and chief executive officer of Resolve to Save Life. Good morning, Tom. Dr. Eunice Pang, deputy director, Department of Policy and Strategy Development, Policy Research and Surveillance Division of the Health Promotion Board in Singapore. Good evening, Eunice. Dr. Sabine Jülicher, the director for Food and Feed Safety Innovation of the Directorate-General for Health and Food Safety of the Health Directorate of the European Commission. Good afternoon. Lorraine Aubert, the manager of the Sun Business Network's Global Partnership and Gain Nutrition for Growth lead. Good afternoon, Lorraine. And Ana Larrañaga, Director General of Salud Critica, which is a Mexican-based coalition. Good morning, Ana. So let me start, if I can have my first slide, please, by introducing the topic. And can I have the next one, please? And really the important messages here are, can I have my next one, please? First of all, that industrially produced trans fat intake is estimated to cause, the incredible number of 260,000 deaths per year. This is due to coronary heart disease. And, we're paying this tribute to the use of a compound which is basically not necessary, doesn't make a major difference in our food supply. And therefore, eliminating trans fat is actually feasible. It's cost effective, will save lives. We're not going to miss anything if we remove trans fat. Can I have the next slide? Why are trans fat producing so much harm? This is really kind of fat that was industrially produced as a replacement for animal fats at the beginning of last century, and it's been used since in industrial processes, but it's actually responsible for a decrease in high density lipoprotein and increase in low density lipoproteins, therefore leading to an increase in the risk of heart disease. We calculate that every additional gram of trans fat increases the risk of heart disease by 5%. And even if you compare to saturated fat, which is also responsible for the increase in heart disease risk, actually trans fat carry a higher risk. Next slide, please. So being aware of this situation, the WHO launched in May 2018 the initiative jointly with Replace to Save Life to eliminate from the global food supply industrially trans fat by the year 2023, only in a 3-year time. And it launched at the same time a package, a tool, we call it the Replace package, that is a step-by-step framework to guide countries' action to eliminate trans fat from the food supply. So what we're doing today is monitoring the progress on the implementation of Replace. Can I have my next slide, please? We have produced in WHO in collaboration with Resolve to Save Life the second report. We issued last year the first report, So this is the second report, which we call the countdown to 2023, countdown to total elimination of industrial trans fat by the year 2020. Next slide, please. The report highlights, describes the policy situation in countries. And we have really seen that there are different kinds of legislation. The best kind of legislation we can have is the one that has mandatory national limit of 2 grams per 100 grams of total fat in all foods, or in alternative, that it also has mandatory national ban on production or use of industrial trans fat as ingredient in all foods. So basically, these are mandatory legislation which ensure that there's no trans fat, industrial trans fat left in the food supply. And you can see in dark green the countries who have put in place as of 2020 this best practice legislation. Then we also have in lighter green the countries who have less restrictive legislation. For example, they're using the 2% limit only in oils, or they use the 5% limit. So not as good, but still some legislation. And you see some countries are also in the process of moving towards the best practice legislation, and that is the shaded area in also in green. You also have other approaches which are less effective, other complementary measures, for example, labeling, leaving somehow the task to the consumers to choose the product without trans fat, or even simply commitments to improve policies. Next slide, please. So the situation is that, as of today, we have 14 countries in the world that have implemented this best practice legislation. We have a bit more countries that have some form of legislation, so the less effective is included in additional 18 countries. So we may say that, at the moment we have 589 million people who are covered by the best practice legislation, 2.4 billion if we include even the less effective legislation. But the good news is that the European Union particularly has passed legislation that will be best practice. It will be in place in 2 years. So by 2022, we will have additional 815 million people covered by legislation. But the bad news is that, unfortunately, there are at least 64 countries in the world, which is 1/3 of countries in the world, that do not have any measure to address trans fat. And if you look at the right side of this panel, you see that, looking at low-income countries, lower middle-income countries, there's no legislation covering trans fat. So at the moment, only the people living in high-income countries are protected. Next slide, please. We see some interesting trends. The first one is that the regional blocs have taken full responsibility on elimination of trans fat. We've had Eurasian Economic Union in 2015, the Gulf countries also in 2015. As I said, the European Union 2019, and also in 2019, the Pan American Organization countries have agreed on a regional action plan for elimination. You'll hear more on these regional trends by Dr. Tom Frieden. Next slide. Second important trend is the fact that countries who have less restrictive limits are realizing they need to set in place best practice implementation policies. And this is what's happening in Saudi Arabia, Peru, Singapore, India. Congratulations, Dr. Teaotia, for your achievement. Uruguay. That's actually what's going to happen very soon. Next slide, please. So how do we scale up progress? How do we reach all those who have not been reached? We definitely need to change the regulation and move towards best practice policies. And national regulators will have will require some help, and their capacity will need to be strengthened. And the fact that regional and sub-regional blocks are going to take this responsibility is also an important way forward. WHO will do its part. WHO will provide technical support for regulatory capacity, will disseminate country experiences, will undertake global advocacy, and we're able now to say that we have a new tool, and that's a recognition of country achievement. Next one, please. On the 9th of September, our Director-General, Dr. Tedros, already announced that WHO would launch a certification scheme. So basically, we would like to recognize the efforts that countries are making to eliminate trans fat and give them a certification similar to the certification of being polio-free or having eradicated another infective diseases. But this would be the first opportunity to eliminate a risk factor for non-communicable diseases. What will we ask the countries to do? To demonstrate that they have a best practice trans fat elimination policy. As I said, either a mandatory national ban on production, use, or sale of partially hydrogenated oils, or a mandatory national restriction that limits industrially produced trans fat to a maximum of 2% of total fat in all fats, oil, and foods. But also we will ask to demonstrate there's effective monitoring and enforcement system in place. So no trans fat is domestically produced and no industrially produced trans fat imported outside of the country. Next slide. But as we said, and this is the topic of our discussion today, industry has a very important role to play. And even in absence of legislation, or while countries develop that legislation, industry can make a commitment and can implement the elimination of trans fat. There's technology there, the ingredients to replace are there, they're accessible to most companies. And in fact, global food industry, the International Food and Beverage Alliance, has committed in May 2019 to eliminate industrially produced trans fat from their products worldwide by year 2023. We need to hold that and see whether that's happening. The other important contributions can come from the suppliers of fats and oils. They can step up and remove partially hydrogenated oils that are sold to food manufacturers globally. My last slide is just to remind us that we have the tools in place, so it's now moving to action. And let me hear about this action in action. And let me give the floor to one of the heroes of this battle. And this is Mrs. Rita Teaotia, who has been the chairperson of the Food Safety and Standards Authority of India since 2018. She has had very important roles in the government. She served as Secretary of Commerce in the Ministry of Commerce and as Joint Secretary in the Ministry of Health and Family Welfare of the Government of India. So, Ms. Teaotia, what happened in India? Over to you.
Thank you very much, and thank you very much for the opportunity to share what we are trying to do in India. As I was organizing my thoughts for today, it struck me that pandemics like COVID burst upon us very suddenly, and they shocked the world into immediate action. But the equally deadly silent epidemic caused by our food habits, despite all the warning signals, tends to be ignored. I think that we all know the link between diet and cardiovascular diseases and many of the non-communicable diseases. But trans fats particularly have a very direct linkage to cardiovascular diseases. India alone is a country which loses 5.8 million people to non-communicable diseases, and the largest share is about 2.3 million annually to cardiovascular disease. So for us, this is something that is immediate, something we have to address on a priority basis. But given our population of about 1.4 billion people, the economic, the cultural, the linguistic diversity we have, as well as a food business community that is largely based on small and medium enterprises with low access to technology, we've had to be very, very practical and innovative in our approach. Our strategy, may I have the first slide, please? Next. Our strategy, therefore, has been a combination of policy interventions, a multi-sectoral connect along with partnerships, and a support to stakeholders along with monitoring of our progress. Next, please. Our journey on the regulatory front began in 2013, although the first draft regulation on trans fats in the shortening products was developed as early as 2009. But we issued regulations in 2013 to limit trans fats to not more than 10% in 4 products, that is inter-esterified vegetable fat, bakery and industrial margarine, vanaspati, which is hydrogenated vegetable oil, and bakery shortening. We reduced the TFA limits to 5% effective February 2018 for the same 4 products. We also introduced label declarations in case trans fat-free claims were permitted. And such claims were permitted if the TFA content was less than 0.2 grams or ml per 100 grams or ml of a food product. So this was issued in 2015. In 2019, we looked at edible oils as well, and this was in terms of claims. If a manufacturer wished to make a claim of TFA-free, then the product had to have less than 1 gram per 100 ml. In the same year, 2019, we launched a trans fat-free logo that could be used by food establishments which were both using TFA-free oil in cooking or serving TFA-free foods to their customers. Next, please. In the same year, and 2019 was a pretty active year for us, we issued guidance to the 2 very large national programs, the Integrated Child Development Program, which provides meals to preschool children, 91.3 million children every single day, and the Midday Meal Program, which covers 120 million school-going children every single day, to eliminate trans fats from meals served to children daily. So this was the 2 large government programs. We amended our regulations to reduce TFA to less than 3% in food products by January 21 and to less than 2% by January 2022. These regulations are as yet draft regulations. The final are in the process of being issued, but the deadlines and dates remain the same. In the current year, 2020, we issued very detailed regulations on safe food and balanced diets for children in school. And this is to regulate the kind of food that is served on school campuses, the kind of advertising which is permitted, place restrictions on the kind of advocacy, even indirect, that can be done for children. We have throughout this period focused on keeping track of where we are going. And this is happening through enhanced surveillance and testing. We've strengthened our laboratory and laboratory network in terms of infrastructure, in terms of methods, and also in terms of manpower. And frankly, this is the single largest investment that the Food Safety Authority does annually. It's the biggest budget line. to make these laboratories move to a certain standard. And we also collaborate with associations like AOAC and USP for method sharing. Next, please. We worked with the industry to take on the kind of pledges that Dr. Branca also talked about. And these are the industry associations in 4 categories. The edible oil sector, that's at 1. The bakery sector at number 2. The food service sector at number 3. And the professional associations, that's at 4. So these stakeholders, totally about 20 associations with enormous membership and reach, have pledged to commit to the trans fat free deadlines and to continuously monitor their membership for the compliance. So this has been an effort to actually reach the industry through the associations. Next, please. This is an interesting initiative because while it's easy for a regulator to make regulation, to actually create an ecosystem that will support that regulation is, I think, an equally important piece of it. Our initiative on repurpose use cooking oil, or the acronym is RUCO, which in Hindi means stop. We issued a regulation which fixed the total polar compounds in edible oils at 25%, and this has been in effect since July of 18. And this has become mandatory for food business operators. But we've worked now with the Ministry of Petroleum to ensure that this used oil doesn't find its way back into the food chain with the smaller vendors, with smaller organizations, which are less strictly regulated perhaps. So we've created a network of aggregators to collect the used cooking oil from food businesses. These aggregators are all linked to biodiesel manufacturers and who convert the used cooking oil into biodiesel and then supply to the oil marketing companies. Currently, we have about 20 biodiesel manufacturers and 20 aggregators functioning. And this is a number that we are working to increase. Next, please. Next. This Eat Right India is really our flagship program to reach out. It's really a people's movement that focuses on reaching out to consumers, but also to all the other stakeholders. It has 3 pillars: eat safe, eat healthy, eat sustainable. The eat safe pillar focuses on hygiene, sanitation, combating the adulteration, reducing residues in food, and dealing with hazards in production. Eat healthy, as you can see, covers balanced diets, dietary diversification, elimination of the trans fats, reducing salt, sugar, and saturated fat intake, and sustainable pillar focuses on local and seasonal foods, reducing food waste, conserving water in food processing, reducing the chemicals in the food chain, and reducing and recycling food package. All these 3 pillars are an amalgamation of regulation, outreach and guidance documents, and continuous stakeholder engagement. Next, please. The most important piece of what we are doing, and really to reach a very diverse population, is trying to reach out to stakeholders. And we're doing it through a variety of tools. The first is the public service messaging. We have video, we have social media platforms, websites. We have films, things like our Heart Attack Rewind and the Aaj se thoda kam, that means from today a little less, these two campaigns reached approximately 34 million consumers with the message of reducing trans fats in the diet. We've also developed handbooks and toolkits to address different categories of stakeholders, whether they are school children, whether they are food professionals, the Eat Right India handbook, the general public, Do You Eat Right, that book that you can see at the bottom. There's a multiplicity of tools that we have created. We've also done toolkits, and this is very interesting because these toolkits are being used to support the field workers of the Ministry of Health and the field workers of the Ministry of Women and Child Development. There's total 2.3 million field staff which are working in rural areas, reaching out to the community with the right messaging on eating right, eating safely, and eating sustainably. We've got national campaigns, and I think this is very interesting. These two challenges, the Eat Right Challenge for districts and towns, and the Eat Smart Cities Challenge, these are currently ongoing. We've had a fantastic response to the Eat Right Challenge. 180 districts and towns headed by their district magistrates have signed up to be part of the Eat Right Challenge. This will last for 1 year. And during that 1 year, they're going to have to show impact on the ground through a variety of initiatives to improve the situation, both in terms of regulatory enforcement, but also in terms of outreach and behavior change. The Eat Smart Cities Challenge is very interesting. It's linked to, yes?
Ms. Teaotia, I need to really thank you very much for this. You want to have a final concluding message?
Yeah, I would like to do that. I think the rest of my presentation is available to everybody, but I think that what we have done in India has become possible because of the collaboration with various ministries, with our partnerships, of course, the partnership approach with industry as well, supporting voluntary compliance, the consumer focus through a variety of tools, and most important, through the political support that the Eat Right initiative has actually received from our minister, from the government entirely, to support the objective of reducing both trans fats as well as ensuring safer, healthier diets for the general public. Thank you.
Thank you very much. And I again congratulate you for the very comprehensive strategy. You moved your regulations towards the most effective one. You had associated measures on labeling, on consumer choices, engaging all the partners. I think it is really a successful model. We look forward to the impact on that. And let me now give the floor to a colleague, a friend, a leader in this space. And this is Dr. Tom Frieden, the President and Chief Executive Officer of Resolve to Save Life, a 5-year initiative housed at Vital Strategies nonprofit global organization. He has been, you know him as the Director of the Center for Disease Control and Prevention and the New York Health Commissioner. And again, thank you very much, Tom, for our leadership and support to this initiative. Over to you.
Thank you very much, Francesco. And it's delightful to follow Rita Teaotia from FSSAI, and very exciting to hear about where trans fat elimination fits in the idea of safe, healthy, and sustainable food. It's a very exciting initiative, and really we look forward to hearing about your continued success as trans fats are eliminated and the other actions are undertaken and make progress as well. So I'll just go through a few slides quickly. If we can go to the next slide. What we see with trans fat, as Francesco mentioned, is that it's more important than ever. You might have people saying, oh, you know, with COVID, we have to put this on hold. The opposite is the case. COVID has taken more than 1 million lives in the past 9 months, but cardiovascular disease will kill 10 times that many people this year. And people with cardiovascular disease are at increased risk of severe illness and death from COVID-19. As has been emphasized, trans fat increases the risk of heart attack and death, and eliminating it will prevent heart attacks, save lives, reduce costs, protect people, reduce inequalities, and reduce the strain on health systems. Next, please. As Francesco showed, there is progress, but gaps really do persist. Most of the policy action has been in higher income countries, particularly in Europe and the Americas. We're looking forward to seeing the enactment and enforcement of policies in India, which would be really a world leader in this regard, because so far no lower income, either low or lower middle income countries have adopted best practice policies for trans fat elimination. Next, please. Regional regulations have enormous capacity. In 2019, the European Union passed best practice regulations, and that one action alone will protect 500 million people in more than 20 countries who are not already protected from trans fat. Next, please. Regional regulations protect more people than country policies, and they require less investment from individual countries. They reduce disparities within regions, they reduce barriers to industry compliance, and they extend the health benefits beyond the regulated areas. Next, please. Industry has an important role to play. Unfortunately, very few multinational food manufacturers and no major fat or oil supplier has committed to elimination. And we've written to them all, and we have not gotten very satisfying replies. IFPA has made a commitment, and we thank them for that, but they represent less than 10% of all of the production globally. Small and medium-sized enterprises dominate the national market in many countries. Major fats and oil suppliers already use the necessary technology to make trans fat-free oils. And we've seen from a place such as Thailand that it's possible to eliminate trans fat on a national basis by simply identifying which are the producers, helping them transition, and implementing a level playing field for all nationally produced and imported fats and oils. Next, please. People often ask, what about the alternative? And with the promote module of the replace strategy, there is a clear approach to different types of healthier alternatives for different uses, whether it's liquid, semi-solid, or solid. There are some that have more positive health impact. There's no simple one solution here. For different foods, for different uses in different countries with different markets, there will be healthier alternatives. But the one thing to keep in mind is that anything is healthier than trans fat. We'd like a replacement with polyunsaturated fats, unsaturated fats, but even if you have to use a blend of saturated and unsaturated, you can have a much healthier outcome. And what we're seeing with many of the manufacturers, what they're learning and what we're learning from them, is that blends are often quite appropriate. Next, please. So at Resolve, we have a riddle. When does 50 plus 30 plus 0 equal 100? If we increase global control of blood pressure from 14 to 50%, reduce sodium intake by 30%, and eliminate artificial trans fat, we will globally, collectively, save 100 million lives over 30 years. Next slide. At Resolve, we support countries to implement the replace strategies. We advocate for regional policy and action, encourage industry action, and we're a little discouraged with that encouragement because other than IFPA, we've seen very little progress, and we think industry may need a bit of a wake-up call from regulators and civil society. We galvanize global action with tools and training, and we support countries and other stakeholders through the links community. Next, please. Act now, because the days of trans fat are numbered. We can replace trans fat in countries and regions, and only our hearts will know the difference. For more resources, please check linkscommunity.org. Thanks very much, and I look forward to the conversation.
Thank you very much, Dr. Frieden. Thank you very much, Tom, for your leadership and also for this very encouraging message. Indeed, action is happening, and this is actually not going to affect negatively the manufacturers of foods, nor the food supply. It's an encouragement to change. I can see there are a lot of interesting questions coming in the Q&A. We'll respond to some of them during this conversation. I'll start with a couple, exactly around, the potential alternatives. Can we use the interesterified fats? Yeah, it's actually something which is being done. We're looking at the potential health effects. It's something to be monitored, but definitely it's an available technology. And what is the limit that WHO recommends for the intake of trans fat? That 1% of total energy, 1% of total energy, including both the industrial and the naturally occurring trans fat. But let me give you the floor now to another colleague, Lorraine Aubert. Lorraine is the manager for the Sun Business Network Global Partnership and Nutrition for Growth lead at the Global Alliance for Improved Nutrition, where she manages partnerships with multinational companies and international organizations. She's been working for the Global Fund, UNFPA, UNITAID, and the French Ministry of Foreign Affairs. And we've been working with Lorraine and the team in a very interesting project she'll tell us about. Lorraine, over to you, please.
Thank you, Francesco. So thank you for the opportunity today to share the learnings of a pilot project we've been conducting on supporting small and medium enterprises in low and middle income countries around trans fat elimination. So we targeted Nigeria and Pakistan, kind of see how we could support them around trans fat elimination. You can go to the next slide, please. And so as stated in the Replace Action Package, and as mentioned earlier, SMEs are the main provider of food in those settings, but in low and middle income countries, we're seeing that regulations around trans fat are not yet in place. So we wanted to look at what are the needs of these SMEs to actually eliminate trans fat. Can I go to the next slide, please? So the project, which was supported by Resolve to Save Lives, looked at 3 key activities. The first one, we wanted to understand trans fat consumption and in-country replacement solutions for both Pakistan and Nigeria, to look at what are the healthier options for replacement, but also options that are affordable for small and medium enterprises. Following the publication of these reports, we looked at in-country workshops on IFTA replacement. And what we envisage here, it has been mentioned earlier, some part of the industry have already made progress around trans fat elimination, and these are the members of the International Food and Beverage Alliance. So we had representatives from IFBA coming to in-country workshops and sharing examples of what they have done around trans fat elimination with local companies, small and medium enterprises in those settings. And after the publication of these reports and those workshops, we had interviews and discussions with the local companies to identify what else is needed for them to actually manage to eliminate trans fat, what is working for them, and what are the challenges they face. Can we go to the next slide, please? So what we learned from the project is that you need to get an understanding of where trans fat is coming from at national level. And that goes to something that has been mentioned in the previous presentation. Targeting oils and fat supplier might be quite an opportunity in countries like Nigeria, where you have trans fat being part of a wide range of product. In Pakistan, it makes sense to look at Banaspati ghee, which is one of the main provider of trans fat in the country. So you can target those companies, you can target technical assistance brief for that particular product. It is also very important to look at the regulatory environments when you communicate to those SME to explain what are the regulations, what are the draft regulations being discussed, not only on national level, but at also local level. You often have local regulations coming first around trans fat, with then the national level being considered. It was also key to understand the private sector market structure in those countries, size of companies, and as mentioned, there is an importance in terms of looking at imported food and locally produced food to get a sense of where the trans fat is coming from. And finally, looking at local replacement alternatives. So as mentioned, in the previous presentation, there is no simple solution for that, but it is critical, especially when you work with SMEs, and the issue of affordability is so important, to look at healthier options that are locally available, because often that will be linked to affordable oils and fats. So we identified groundnut oil as very interesting for Nigeria as a replacement solution, which is affordable and healthier, and potentially mustard oil in Pakistan, which used to be produced, but is not produced at a large scale right now, but would represent a healthier, affordable option to replace trans fat. Could we go to the next slide, please? So overall, one thing that really helps is awareness on trans fat. We were talking to food producers, but the vast majority of them in those settings had either no knowledge whatsoever of what trans fat is or very limited knowledge. So we need to explain what trans fat is, its health impact, the sources of trans fat, what are the practices that increases the level of trans fat. We also started with the idea of leveraging really the expertise of those multinationals from IFBA that have achieved a lot of progress around trans fat elimination. But what our local companies told us is that networking opportunities at country level are very helpful, because then you have companies learning from other companies that have the same challenges, that target similar customers. And so what we're looking at from Sun Business Network is increasing the number of opportunities for peer exchange among similar companies around trans fat elimination. And finally, looking at the laboratory capacity is key. So you need to understand that a lot of those companies at local level don't have necessarily the capacity to test their products and get a sense of trans fat content. So we need progress around that. And obviously, when you have regulations in place, you need to make sure that in those settings, the products are tested so we know there is compliance. Can we go to the next slide, please? So finally, the gaps that we're seeing from the project is that, I think we initially looked at the range of products that will have trans fat, and we thought about targeting SMEs that produce all of those. But as mentioned earlier, it can make sense, can be very efficient to actually look at fats and all suppliers, because when you look at the diversity of SMEs, when you look at the resources they have, that is quite a difficult job to get all of them briefed about trans fat, receiving technical assistance on how to eliminate it. So targeting fats and all suppliers really seems as an efficient way to get changes when interacting with the private sector in trans fat elimination. We need to see a comprehensive approach on trans fat content. So anything is better than trans fat, but there is also an opportunity to try to push for the healthiest options possible. And SMEs don't necessarily have knowledge in terms of what are the best options available. So because we have an opportunity to communicate on trans fat elimination, we should use that also to communicate on healthier saturated fats options in those settings. What we're looking at as well in terms of follow-up is pre-recorded virtual trainings on trans fat for SMEs. Because often when you do workshops and when you liaise with local companies, you have access to the ones located in urban settings, but you will have difficulties accessing those SMEs in more rural areas. They also need to have information around trans fat when they're actually looking at elimination, and that will also potentially change based on local and national regulations timing. And finally, I think it's really important to see hopefully more and more regulations coming in low and middle income country around trans fat elimination, but regulations that take into consideration the challenges faced by SMEs. So very simply, the issues around those SMEs that are having staff with technical knowledge and capacity to implement solutions for trans fat eliminations, the issue around accessing funding and finance, even in new equipment for their manufacturing. So these are key points that we hope will be considered. So that these are the key learnings and improvements we're looking. Thank you for listening, and happy to answer any questions you might have later.
Thank you very much, Lauren. And clearly you've highlighted the centrality of dealing with small and medium enterprises. They actually account for the majority of food producers in food systems. And certainly in the countries we've been looking at, they are a critical reality. So if we want to eliminate trans fat, they need to have the knowledge, the capacity to access the technology and the information and to access the replacements. So, looking a bit more upstream, what is needed and what kind of support governments can give also to small and medium enterprises. And this leads us to the next speaker, Dr. Sabine Jülicher. And Dr. Jülicher is the Director for Food and Feed Safety and Innovation in the Directorate-General for Health and Food Safety of the European Commission. She's responsible for policies relating to a range of sectors, including food information and composition, food processing technologies, novel foods, and biotechnology. And she's going to tell us about this fascinating journey that has led the European Union to pass this new legislation. Dr. Jülicher, the floor is yours.
Yes. Hello, thank you very much for giving me the floor, and thank you very much indeed for organizing this very relevant and interesting meeting, because healthy diets, that is extremely important at any time, whether we are facing a pandemic or not. We already heard from you, Dr. Branca and Dr. Frieden, about the EU measure, and I would like to share a few views on that for the European Union. Indeed, we succeeded, next slide please, we succeeded in 2019 to adopt legislation. So what we have chosen in 2019 is to have a legally binding solution legally binding for all 28 EU member states at the time. So indeed, we will be covering 450 million consumers with this legally binding measure. You will see at the very bottom of the slide that, yes, we agreed in 2019. However, we provided also for a fairly long transitional period till 1st of April 2021. By which date food which does not comply with the provisions on industrial trans fatty acids, they may not be on the EU market anymore. And that refers to EU-produced foods, but that also refers to imported foods. Why this long transitional period? This is a particular recognition of the situation of, in particular, small and medium-sized enterprises who asked and made it very clear to us that they need a longer transitional period for reformulation and adaptation. So what have we decided? If I may go back, sorry, what have we decided? We have decided on a maximum limit of industrial trans fatty acids of 2 grams per 100 grams of fat. This is in Europe equivalent to less than 1% of the energy intake. So this is very much in line with the international recommendations. And this is the rule, this maximum limit for any food which is intended for the final consumer, and also food that is supplied to retail. Retail in Europe means also restaurants, food services, shops, distribution centers, and so on and so forth. So in effect, it means any food that reaches the final consumer in Europe must respect this maximum limit. You will also see that there is a different regime when it comes to business-to-business contacts, business-to-business trade. There it is possible that certain foods exceed the maximum limit that we have set. And this is only possible that it exceeds when there is also transmission of information of the actual amount. You will wonder why that is. For example, there are producers of certain semi-finished products, certain glazes, certain icings that will be used just in very small amounts on the finished food. We wanted to continue allowing this type of product, but we wanted also that the receiving business has a very clear idea of what they are receiving, and that then on that basis they can make the calculation for their own products. So what it does, it is helping to maintain certain recipes, but also it helps the final producer, the final bakery, for example, to apply the overall maximum limit and make sure that their products are not exceeding the 2 grams per 100 grams of fat. Next slide, please. Here I have a couple of, issues, successes that helped us really in the road to adopting this legally binding measure. It helped that we had clear evidence from risk assessors, WHO, but also the European Food Safety Authority, on the clear link between the measure between trans fatty acids and health. We had already in Europe quite some experience with legal measures in individual member states and a couple of voluntary initiatives in member states. So we had a lot of learnings internally. There was a lot of stakeholder support at the time. Industry associations, non-governmental organizations in the health and consumer sector, they were all very much demanding a clear measure. We had also societal and economic advantages shown in a comprehensive impact assessment, where I can share some insights. Given the particular situation of the EU, there was also a strong plea that we find an EU harmonized solution, because that facilitates the intra-EU trade, what we call the internal market. So one limit, one measure for all facilitates, the intra-EU trade. The global move away from industrial trans fatty acids helped as well, and there was also and still is media pressure and support for the general direction. Next slide, please. I should also not hide that there were some challenges, and these are around small and medium-sized enterprises. Just for you to understand that also in Europe, we have about 99% of all EU manufacturing and food service enterprises designated as small and medium-sized. So they were obviously concerned how they could comply with these new rules, without disproportionate investment in reformulation or testing. Reformulation, we know, is no problem whatsoever for large suppliers, but reformulation has been recognized as an issue for SMEs. So with the measure and with the way we also introduced the labeling requirement for business-to-business contacts, we wanted to take as much pressure away from the SMEs. And last but not least, when we introduce such legally binding measures, we are also very concerned that we have an analytical methodology for the enforcement. In the European case, we need to differentiate in the end the industrial trans fatty acids, which we regulate from any other naturally occurring ones. And there I'm very pleased that we expect in a couple of weeks' time that the analytical methodology can also be shared publicly with everybody. So we will be ready for the 1st of April 2021, including for the method. Next slide, please. Just for those that are reflecting, what approach they might be taking in for themselves in the future, we have studied the various options that were on the table really in depth, and the outcome of this study and impact assessment is also available online. So we were considering to limit the industrial trans fatty acid content in food, either by voluntary agreement or in a legally binding measure. And as you now know, we in the end settled for option 1B, where we have this legally binding measure. But we also studied just the obligation to indicate the TFA content of foods in the nutrition declaration, basically a labeling only approach. And we studied the option that is used in other parts of the world to prohibit the use of partially hydrogenated oils, also on the one hand in a voluntary measure and as a legal measure. And we looked also at the various sub-options. So next slide, if I may. This is a bit of a busy slide, but basically what I want to tell you is that on the basis of this impact assessment, which looked at health benefits, which looked at reduction in health inequalities, which looked at functioning of the EU internal market, aspects of efficiency, consistency, and proportionality, we clearly came to the conclusion that what we call option 1B, so a legally binding limit for industrial trans fatty acid content, and option 3B, a legal measure to prohibit the use of partially hydrogenated oils, would fare best. So these legally binding approaches were the best in terms of what I said, health benefits and the rest. In the end, the EU, as I said, settled for the legally binding limit for industrial trans fatty acids. There were two aspects relevant for the EU decision. One was that we already in the existing legal framework had definitions for trans fatty acids, so we didn't need to create anything new. And we were also much more comfortable with the analytical testing methodology that we could develop for trans fatty acids. So this all in all taken together also with the experience of the member states that had already certain measures in place, made us settle on the industrial trans fatty acids 2 grams per 100 grams of fat as a legally binding measure. I believe this is the end of my presentation, just to double check. As I say, in principle, we are already implementing the measure now. The final moment that food that doesn't comply with these provisions has to leave the market will be 1st of April 2021. And I'm very pleased to say that so far in this implementation period, we have not encountered any insurmountable difficulties, be it for the sector or be it for the consumer. And just as a final word, with this legally binding measure, we have made life fairly easy for the consumer. They don't have to study labels. They don't have to make calculations. So for anything that they are buying in a pre-packed or loose way from the shops, from their bakery, from what they're getting from their restaurant, will be complying with this legal limit of 2% trans fatty acids in fat. So with that, thank you very much, and I'm looking forward to the discussion later.
Thank you, Dr. Jülicher. And again, very interesting to see that this has been possible without too much trouble and with the consensus of stakeholders. But eventually, you decided that the regulatory one was the best, the most the most effective action. That's important to know. I'm going to give the floor now to Ana Larrañaga, the Director-General of Salud Crítica, the Mexican NGO that coordinates the Contrapeso Coalition, a network of organizations with emphasis on policy measures for the prevention of overweight, obesity, and diabetes. She also manages the Food and Nutrition chapter of the Mexico Saludable Coalition, which seeks to address the main modifiable risk factors of non-communicable diseases. Ana, what's happening in Mexico?
Hi, good morning and good afternoon to everyone. And first of all, I just wanted to thank you all for the opportunity to present here. And I'm going to talk a bit about the experiences we have faced in Mexico. So I don't know if you have my slides. Thank you very much. Yeah, so firstly, I want to also thank the Mexico Saludable Coalition, which is the coalition that has been fighting for these small advances in Mexico. But even though they're small, I think we are on track and we are decided to act on NCDs through the regulation on these fatty acids. So next slide, please. So the situation in Mexico, as you know, we have a high rate of overweight, of obesity, in general of non-communicable diseases, and heart disease is at the top of these complications. This slide is showing the consumption, the population consumption of different types of food. And I'm sorry that this slide is in Spanish. This is from our last nutrition survey, national nutrition survey. And you can see in the second panel where it says botanas dulces, that means snacks, sweet snacks and salty snacks. And this is the second category of not healthy foods that is most consumed in our country. And as you can see, children, even from the ages of 1 to 4 years and 5 to 11 years, are eating this type of products on a regular basis. We are also consuming a high amount of other non-beneficial products like sugar sweetened beverages, but that's another issue that we are also working on. But what we realized was that this was a problem because we are talking specifically about ultra-processed foods, and we didn't have any idea of what was the level of consumption of trans fatty acids in the Mexican population, and specifically industrially produced ones. But we do know that the consumption of ultra-processed products that may have these components is very high in all population groups. So next one, please. So with the Mexico Saludable Coalition, we developed the first situational analysis. This is entirely developed by NGOs in Mexico. And we decided to study what was the consumption of trans fatty acids. We found that there is a lack of information in general, firstly, because when we did this research, the declaration of trans fats in the food labels was optional. So we did not have like a guarantee that the information that we were researching and providing was entirely 100% true. So that is a small advance that we've had since the front of pack labels changed. But by the time we did this analysis, we are pretty certain that we have an under registration of the amount that we are eating. There's a lack of updated data and then underestimation in these results, even though the results show that the amount of grams per day that the population was consuming was not problematic. And this was problematic for us because we clearly see that the heart disease and these related conditions is very high in the Mexican population. And this is an argument that we also face. We often hear that this consumption is not that high, so we shouldn't be worrying about this. But the way we see it is we do not want to act on it when it becomes problematic if we can act on it in time before it causes a really greater damage than we already know. And of course, we need to consider that now we have information that Mexico is in the top 10 of countries for mortality related to iTFA. And this is information that we got after the release. So it is problematic, even though many times decision makers don't see it as such. So we also decided to monitor what were the existing routes to address in the Mexican regulatory framework, because we strongly agree with what has been discussed during this panel, that the mandatory legislation is the gold standard, and it is what we are trying to achieve here. So next one, please. So this is some of the information that we found. This is the main sources of trans fatty acids in the Mexican consumption. But this is not the most updated information. However, we see a lot of products that the population consume in a daily basis, and some products that we were surprised that had these type of fats, because for example, some small condiments for preparing soups had them, and we weren't aware of it. So this is something that we think it's slowly going to change given the new legislation. So next one, please. So we also started working with key stakeholders to work towards the elimination of industrially produced trans fats. So we held several meetings in Mexico in 2019. We held our first national meeting on public policies towards this elimination. This was held in Mexico City in July of 2019. And I was looking through the questions that some of you are sending, and some of the questions were precisely about where's the involvement of civil society. And I think Mexico is doing a great job at this. We had the participation of over 30 national non-governmental organizations that are working either with patients or food policy and food health. We also participated at the workshop on regulatory mechanisms to eliminate these trans fatty acids. And this was convened by the PAJO also in July of 2019. And during this workshop, we also had the participation of legislators and COFEPRIS, which is our national regulatory agency. So there is good political will right now. And we also released a policy brief, both digital and physical, and it is available on our platform at the Mexico Saludable Coalition. So we have been working towards this since 2019. And also in 2020, we have this new warning labeling law that has been very, I think, famous in the region, especially. And this is the first time that we have a mandatory declaration of trans fats in the nutrition facts panel, and also a black warning label at the front of the pack. And we use the PAJO nutrient profiling system to determine whether a product should declare this. So we know it's pretty strict. So we also want to state that even though we know that there are commitments from some food and beverage industries, in Mexico, we faced a very strong opposition from these industries when discussing this NOM. And surprisingly for us, the discussions were against having to declare the presence of these trans fats, not even about eliminating them. So I think it's very important when industries make this commitment that it really goes through to the people that are working in countries, because I think sometimes at the international level, it's easy to make these type of commitments, but when we see the way that they are behaving in country, the reality is very different. So at the end of the day, we managed to have the mandatory declaration, and we know this is not the only way to go. We also want the regulation where it can be eliminated and not just declared because we want to help consumers in the best possible way. We have also faced legal threats against the Ministry of Health in Mexico, and these have been legal threats by the food industries. So we are hoping the cooperation and the realization that this is a public health issue.
Anna, can I ask you to wrap up?
Yeah, sure. So next one, please. Yeah, so this is just to show you the health campaign that we have in Mexico. So the Ministry of Health is really making an effort to inform the population that trans fat do not provide any health benefits. So we are having an advance in that. And we are still working towards elimination, but we are having, I think, a solid first step. And I think the next one is the last slide. So we are also happy to use advocacy tools such as the action plan convened by PAHO for the elimination, and civil society is very active and very willing to support, especially in the advocacy part, but also for the evaluation and to make sure that these policies are enacted properly.
Thank you, Anna. And I think your presentation has really answered several of the questions which we had, and that was, where do you start if you don't have anything, and how do you create awareness in the population? And that's actually what the presentation of Mr. Larrañaga has indicated. That's basically the way that Mexico has followed. Let me now move to the last of our presentation. We move again back to Asia, and we move to Singapore particularly, where we're going to hear from Dr. Eunice Pang, the Deputy Director in the Department of Policy and Strategy Development in the Policy Research and Surveillance Division of the Health Promotion Board of Singapore. Eunice has worked on healthy food products in joining the Health Board in 2013, including overseeing the Healthier Choice symbol program and working with industry on R&D solution. Dr. Pang, over to you.
Yes, hi, hello, good afternoon and good morning to everyone. Yeah, it's nighttime here just in case. Okay, so thank you for this opportunity for having me here to share about Singapore's experience in our ban or tackling of the trans fat in our food supply. I understand that we were a bit over time, so I'll try to make this short and succinct. Okay, so just a quick introduction. Health Promotion Board is actually under the Ministry of Health. So we are a statutory board and we do work on policy matters together with Ministry of Health Singapore. So very quickly, just to introduce, our first trans fat policy in Singapore came into effect in 2013. Just to provide some context here, this was based on our National Nutrition Survey, where we found that 3 in 10 Singapore residents aged 18 to 69 actually exceeded the WHO limit for trans fat intake of no more than 2.2 grams a day. So to actually address this problem at that time, we actually conducted a whole landscape scan, and we decided to mandate or legislate a 2% trans fat limit for all fats and oils across retail means business to consumer foods, as well as B2B, all the oil manufacturers, oils and fat manufacturers. So these ingredients are actually responsible for the main source of trans fat at that time because they're upstream ingredients, okay? And with that, then with that mandatory 2%, 2 gram per 100 gram trans fat limit, we also mandated the labeling of trans fat on packaging for all fats and oil, which means in your nutrition facts panel, they have to declare the amount of trans fat that's there. This is also to help us facilitate the enforcement as well as to help consumers make informed decisions. In addition, leveraging on our voluntary front of pack program, we also introduced a trans fat free claim where we have more stringent limits on a voluntary basis for food products to meet to even declare to be trans fat free by lowering the trans fat content even further. Next slide, please. Okay, so this is the overview of how the landscape looks like before the first legislation and where we were at in 2018. We see that with the introduction of the 2013 trans fat limit, the trans fat in our local Singapore diet or from the market scan has dropped from 60% in the food service down to about 10%, right? And now this makes trans fat from pre-packaged food in the retail sector responsible for the majority of trans fat in our diet. So in 2018, we conducted a market scan of all pre-packaged food by sending, randomly sending products to the labs for nutrient tests just to check. Most of this would have to be imported products because not forgetting that all the fats and oil already were under a 2% trans fat limit. We also conducted checks on ingredients declaration. And of course, not surprisingly, the trans fat, the artificial trans fat actually mainly concentrated in these 4 categories, which is your, frozen cakes, pastries, snacks, prepackaged meals, as well as some of the fat spreads. And these just mainly refer to prepackaged foods. Next slide, please. Okay, so looking then into the previous slide was on the market scan. This is now on the national nutrition intake. And thanks to this 2013 trans fat limit, we can see that, we have successfully halved the trans fat intake in 2018, right, to about 1 gram per person per day. But in our newer, nutrition survey in 2018 that we conducted, we found that certain segments of the population still have higher than average daily intake of trans fat. This is mainly due to their consumption patterns of, prepackaged products, convenience foods, and the likes. So with this information and finding, we then decided to move upstream to look at to target the main source of artificial trans fat in our diet, artificial meaning industrial trans fat, which is partially hydrogenated oil. And this at that time also coincided with WHO's call on to eliminate trans fat by 2023. This call was actually released in, I think, May of 2018. So if you could move to the next slide. Okay, so this nicely summarizes our two-phase approach. I've gone through the 2013 legislation of the limit. So in 2018-19, we embarked on looking into banning this, the source of this, the ingredient responsible for this industrial trans fat, which is PHO. So we then started work, and basically this ban will apply to all foods sold in Singapore. It targets all the importers, manufacturers, as well as distributors for this prepackaged food. So essentially we're talking about the entire food supply. And this will also supersede the existing 2000 trans fat limit, because this one mainly only looked at fats and oil, but now we're looking at the ban at the ingredient level. So it's entire food supply that we're looking at. And why did we decide to go with a ban this time instead of extending the limit? We felt that this was a more direct measure based on Singapore's context, and most of our food are imported. It's a more direct measure because manufacturers can completely omit the use of partially hydrogenated oil or industrial trans fat per se. And for compliance, this is also a more direct method where we can just go look at or ban this at the ingredient source. And we also know that with the movements of PHO ban around the world, there are also good enough alternatives to PHOs today, which would also help in reformulation. Okay, next slide, please. Okay, so just to elaborate, this ban, the announcement of this ban was in June 2019, and it will come into effect 2 years later, which is June 2021. With this announcement, we also, prior to this announcement, actually, we conducted extensive, industry stakeholder consultations held with a diverse range of stakeholders, including importers, distributors, as well as retailers of products, which is really because we wanted to evaluate the impact of such a ban would have on the industry. The stakeholders consulted understood the rationale for the proposed ban in terms of the positive health outcomes. We all know trans fat, especially artificial trans fat, is bad for you. So they actually committed their support. And also given the readily available PHO-free alternatives such as sunflower oil, canola oil, they also recognize that reformulation could be readily achieved if given enough runway. So the 2-year runway was actually decided after consultation with industry, who shared that they will need time to phase out PHO-containing foods and source for the PHO-free alternatives for retail. And with this ban, we also, with this announcement, we also announced an industry pledge where this time we work with 6 major industry members, mainly the local distributors, as well as major supermarket chain retailers, because retailers also import their own food products, because the problem here is more at the prepackaged food. And they have pledged to make their products PHO-free 1 year ahead of the 2-year timeline, which is actually by 2020 June this year. Normally we actually did a surveillance and monitoring of their product in July, but I think, as we all know, we're all caught up in fighting COVID. So we actually did, our data right now is just up to beginning 2020. So far, we see that some of these members have already made efforts in reformulating and bringing in the PHO-free variant into the Singapore market. The pledge really aims to produce competitive competition, which encourages other companies to also help accelerate their reformulation if they haven't already done so. So just next slide, please. Just very quickly, this is just to give an example of a reformulated product in the market when we work with industry and also for consultation in 2018 or so. This is a small SME in Singapore that makes this product overseas. At that time, this product actually contains PHO. And by the end of 2019, he actually came forward and showed us the reformulated product, because they managed to swap out the PHO at the manufacturing country of this product. So this is just one product that we have. Next slide, please. Okay, so this brings me to the last point I have. So as part of healthy living, HPB actually focuses on creating healthier options, food options, leveraging on supply, working in industry to increase supply, working on industry partnerships, and also generating consumer demand. You can see that, by growing supply of healthier food choices, we work through our voluntary programs. Increasing demand, this is where we go big on our public education as well as marketing campaigns nationwide, working from schools to the general population. And of course, underpinning this, we also have regulatory measures to spur options, healthier options in both supply and demand. One of which now would be the trans fat ban. The other would be the labeling for SSB. So we actually use this multi-pronged approach, coupling both hard measures with soft promotional and educational efforts as part of effective stakeholder engagement. As we all know, while legislation is a powerful tool for systemic changes, there's no silver bullet. So, so this brings me to the end of my sharing. I'll be happy to take any questions or for discussion later. Thank you.
Yes, thank you, Dr. Pang. And actually, yes, that's what I would like to do. We have, unfortunately, not a lot of time left, and we have a lot of questions. But I'll basically ask one question to each of the speakers before we get to the final concluding remarks of Dr. Frieden. And I'll follow the reverse order. So I'll start with you, Dr. Pang. And the question is, how will Singapore ensure that replacement fats and oils are healthy? So in other words, how can you ensure that you don't put back saturated fat instead of the trans fat?
Okay, so as mentioned earlier, Singapore takes this broader, which is my last point, ecosystemic approach to ensure healthy eating, and using a suite of programs. And in one of our programs, which is quite mature, I think we've been using this for the past 5 years, is that we do look into, we do have grant schemes and promotional measures in place to look at healthier oil. And our healthier oil is talking about oil blends. Because as we know, Singapore is surrounded by palm oil producing countries. So instead of oil with very high saturated fat, we're actually encouraging lower amount of saturated fat in that. And so this is how we do it, a combination of voluntary programs, sustained, committed stakeholder engagements, working with the industry, as well as coupling that with regulatory measures to curb this limit. And at the same time, we also use our National Nutrition Survey, which moving forward will be done on a every 2-year basis to monitor the amount of trans fat in our diet. And actually the good news is that trans fat intake actually has come down in 2018 based on the report. So yep, I hope that answers.
Yes, great. Thank you. Thank you. And this is the good news. And I'm now going to ask a question to Anna. And there's a question about opposition. Yeah, when there's stakeholder opposition, you know, what can you do? What's the role of civil society there?
Yeah, so I think civil society in Mexico has had a really strong role by making a public denounce whenever there's an opposition to a public health policy, whatever public health policy we are talking about. So we have been very present in the mass media with public campaigns. We have not as much reach as probably other stakeholders do, but we do have a lot of also alliances with researchers. So we are also always sharing evidence-based policy proposals. And I think that really strengthens our point of view because we're not standing alone. We are standing on science and defending the public interest and the health of the population. So we are constantly making this type of alliances with other NGOs, with government organizations whenever possible, and with the mass media communicators.
Thank you. Conflict of interest, that's also an issue that when we engage with the private sector, we need to deal with. So that's another one. And there was a question that I would like to ask Dr. Jülicher. I mean, the European Commission does very thorough impact analysis. Did you have any consideration about the impact on food retailers? There was a question about food retailers.
I mean, we did look at the entire chain. I mean, from the production to the retail. But in fairness, we did not come across really issues for the retailers as such, because much more the responsibility sits with the manufacturer. They are obviously affected because they have to reformulate and you know, send the necessary information if need be. And you know, the final, say, bakery or small enterprise that also has to look at their recipes. But the food retailer as such, no, I mean, we didn't feel that they were much affected by the whole concept. Now, what is interesting is obviously, you know, depending on the measure you take, you have different responsibilities. So, for example, if you aim for a measure that is related to labeling, which in the end the EU didn't do, the costs are at a different place than when you aim for a more of a reformulation exercise. But I recommend, and I shared the link to our website where we have also the details of the impact assessment, which also describes in monetary terms, you know, what are the benefits and costs of the options that we studied.
Thank you. Thank you. Extremely helpful. Thanks a lot. And then, you know, the question of the questions, the mother of all questions, I would like to ask Lauren. Give us your perspective. Industry pledges. What do we know about the implementation?
Well, I think with industry pledges, what we've seen even in high-income countries where you have multinationals producing, you're seeing voluntary pledges are not the ones that got the most results. So I think for us, when we're now looking at low and middle income countries where we're looking at SMEs, we need to go with mandatory regulations. I don't think it's very realistic to expect SMEs with the challenges they face in those settings to actually do voluntary industrial pledges there and to get changes through those ways. So I think for the role of the industry, it's important to have discussions, especially with SMEs, to understand what are the needs, what are the realistic timelines you need to put in place, what are the needs in terms of ensuring compliance. It's not only about having the regulations, it's about having strong compliance afterwards. But especially in low, middle income country settings, SMEs, it's really through mandatory regulations. I don't think it would be really impactful to have industrial voluntary pledges there.
Thank you. So, accountability and good monitoring mechanisms, that's what we need. Tom, we had many questions about countries who want to take action. They say, well, where do we start? This is a country without a policy. What's the starting point? What's your advice to countries who want to start?
Well, I think it's really important to say that banning trans fat is beneficial at every income level, and increasingly so. Trans fats days are numbered, and lower income countries are at risk of manufacturers dumping product on them. Implementing best practice policies save lives, reduce costs for government, reduce healthcare costs. During the pandemic, this is particularly important, and the detailed modules of WHO can really help countries implement best practices. So we know why, we know what, we know how. The challenge really is strengthening both WHO and civil society and government, all three players, public sector, civil society, engaging business, and to the greatest extent possible, getting rapid progress so that there isn't any backsliding and there's continued momentum. Fundamentally, we need momentum because there is progress. You've seen the European Union, you've seen excellent activities from India, Singapore, Mexico, elsewhere. So there's a lot of progress, but unless we have civil society activated, government accountable, and all of us tracking the progress globally, we won't reach this wonderful, inspiring vision of a world free of trans fat by 2023.
Thank you, Tom. And last question to Dr. Teaotia. What can you advise to Nigeria? I mean, they say we have a lot of illegal trade, food coming in that is not controlled. What can you advise on those customs control?
There is the answer to that really is a political will. And if there is a political and regulatory will, I think the engagement with stakeholders and just beginning to roll, but it will need collaboration. Nigeria is positioned much like India. We have needed the collaboration of scientific institutions working with small industry associations for reformulating of products. We've needed advocacy and demand generation from consumers, and we've needed the political support and partnership as well of related ministries. So I think we start with a political will and then bring in the stakeholders. That's the way we did it.
Political will, absolutely. Thank you very much. Tom, your last words.
Well, first I want to thank all of the speakers and participants for joining. COVID-19 has with good reason captured global attention, but it hasn't diminished the importance of addressing non-communicable diseases. And in fact, as we've heard, addressing risk factors for cardiovascular disease is more urgent than ever. Trans fat elimination is, I like to say, the least hard of the non-communicable disease efforts. That doesn't mean it's easy, but it's a straightforward nutrition policy that prevents heart attacks, can save hundreds of thousands of lives, and reduce the burden on already overtaxed health systems. Trans fats can and must be eliminated. WHO has made a clear commitment to 2023 trans fat free. And we heard exciting announcement of a certification program for countries that have best practice policies in place. It's a really important step forward, not just to recognize hard work, but also to encourage countries to cross the finish line and eliminate trans fat. It's the first ever program of its kind. Never before has WHO certified countries for eliminating a risk factor for non-communicable disease. As with other elimination and eradication programs, smallpox, polio, lymphatic filariasis. This will establish accountability and accelerate progress toward the 2023 target. We move closer to this target through regional regulation and leaders like Singapore and Thailand, and we look forward to real progress, continued progress in India with such a strategic approach by learning from successes and challenges from around the world. We heard some key themes here: the importance of regulation. Regulation and regional regulation is a powerful vehicle, whether it's the EU, the Gulf Cooperation Council, the Eurasian Economic Union, or PAHO. This can catalyze progress. Lessons from the European Union about the role of evidence linking trans fat to health outcomes, and the role that champion countries can play catalyzing broader regional action, and the role of media and advocacy. In India, a multi-sectoral integrated approach to trans fat policy making, looking at safe, sustainable, healthy food, engaging industry and the public. We commend India's leadership and look forward to passage of a best practice policy there. There is much more action needed from companies themselves. We hear about the reformulation challenges, and there's an urgent need for fats and oils manufacturers to step up and provide healthy products to their customers. That's especially important in emerging markets, which commonly have many small and medium enterprises. And the importance of monitoring. From Singapore, we heard about the importance of monitoring, looking at data to revise policies to address all population subgroups. We congratulate Singapore for announcing the PHO ban and look forward to its implementation next year. Regulating trans fats is one of the most important aspects of comprehensive nutrition policy. The ability to regulate and monitor reflects both government capacity and the involvement of civil society for broader nutrition policies as well. These should include not only trans fat, but also sodium reduction and reduction of added sugars, sugar-sweetened beverages, and saturated fats. In the context of the pandemic, trans fat and other nutrition policies have to be integrated to help respond to the pandemic and reduce non-communicable diseases, support economic recovery, and increase health security by making current and future generations more resilient and healthier. Achieving a world that's trans fat free by 2023 is an important beginning of a broader success in nutrition and NCD policy, and in recovery packages to build sustainable, high-impact global health systems. Thank you so much. It's been a pleasure and an honor to learn from and with you today, and I look forward to lots more progress ending trans fat. The days of trans fat are numbered. Together, we can make trans fat history.